Margaret, thanks for coming in today and joining us on the Cancer Stories programme. I want to welcome you to the programme, and I know viewers will be interested in your story. I heard your biography that you suffered a uterine cancer. You're actually the first person to come in and talk to us with a uterine cancer, so I'm very interested to hear and learn more about it. Could I ask you at the beginning how it came about? What was the first sign something was wrong?
The first sign something was wrong was in August 2011 when I had 4 periods within 9 weeks. They were a lot heavier than my normal period, and I had quite bad flooding. And I felt it was not normal. I was still having monthly periods every 4 weeks, and 4 periods within 9 weeks was just not the norm. So I went off to my GP immediately, and they automatically referred me to a gynaecologist at the Leicester Royal Infirmary. I went, I think, in September 2011 and was given a hysteroscopy where they have a look round and they take a biopsy of the lining of the uterus. I was actually diagnosed at this point with complex hyperplasia, which is a non-malignant condition. It's just a thickening of the lining of the womb. And I was at a level 2 out of 4 with this condition. There was a potential that it could develop into a cancer, but it was actually a very, very low risk, and I never thought anything more of it. At that point, I was put on progesterone for 3 months. I think it was at the highest dose for the longest time. And I went back after 3 months and again had another hysteroscopy, and things had not changed. I think usually they find that it can go away, but it hadn't. I came back again, I think another 3 months later, and I did ask for another hysteroscopy. And it was at this point that the cancer was actually found. I'd got an appointment at the end of January 2013 to go to a different hospital, a different consultant. And I thought it was a bit strange, but I trotted along the following Monday. And it was at that point that I was given the diagnosis. So.
How was that process handled when you were given the diagnosis?
Well, I was on my own for a start off. I was not told to bring anybody else along with me. So I was on my own. The word cancer had never been mentioned. And it was one heck of a shock because I wasn't expecting it at all, no.
No. Do you think in retrospect that should have been done slightly differently?
In retrospect, I'm actually glad it was done by myself, actually. It's, I think if I'd have been dealing with other family members and having to consider how they would handle it, I actually feel it's better that I did it by myself.
What information did they give you initially about how the cancer looked, either the stage, how aggressive it might be, the future, how were things looking at that moment?
I actually wasn't given any grading at all at that particular point, but I was told by the nurse that I wasn't to worry, that it could be dealt with. I had been told I would need a hysterectomy literally in 4 weeks' time. It had already been booked, the date had been booked, the operation had been booked, but I was told that the prognosis looked good. There was a possibility I may need radiotherapy when they opened me up. They had to find out how things were going once I'd been opened up. They did say it was a slow growing cancer, so which was good.
Did they know that from the biopsy?
I think so, but I think generally uterine cancer is a slow-growing cancer and it's contained within the organ. So it takes quite a while, I think, before it spreads out into lymph nodes and to perhaps the bladder the bowel, any other organs around. So I think they were quite confident that it could be dealt with at that stage.
Out of interest, do you know the typical symptoms that people present with the uterine cancer? Just in case people are watching and they want to know, I know what to look out for now.
Yeah, it's generally unexplained bleeding. I mean, at one point, this disease was generally just seen in postmenopausal women over 50. So any bleeding that shows up after the menopause was a cause to be checked out by your doctor. But increasingly, with a change in lifestyle nowadays, they are finding that more and more younger women are actually being diagnosed. I think a lot of it is weight problems. Obesity is seen as more of a risk factor. So I think younger women need to be aware of any heavier periods, anything that's a change in their normal cycle. It's to get it checked out by your GP. But actually, GPs themselves need to be more aware that it's not just a disease of older women. So if younger women are showing up in your surgery with heavy periods or unexplained bleeding, different any pain or bloating, they need to be aware that there's a possibility that a uterine cancer could be there.
And it's one we don't hear so much about compared to other cancers like breast cancer, prostate cancer and other cancers.
But I mean, since I've had the cancer myself, it is actually the fourth commonest cancer in women. It's actually more common than cervical cancer and ovarian cancer. And there are still 1,900 women a year who, in the UK, who die from this cancer.
That's very valuable to know that.
For something that's actually an unknown cancer. I didn't know about it till I was diagnosed with it myself.
We all need to be a bit more aware of this area, I think. And what about the idea of support groups and resources that are out there? We're jumping ahead to what you may have found later, but just while we're on the topic, is it a cancer where if you reach out and look on the internet, there is a lot of information and support, or is it one of those areas you're struggling to find good resources?
I've actually only found a womb cancer support group just literally in the last 3 to 4 months. It's actually online, and it was set up by a lady in 2011. She was diagnosed in 2009 and found that there was very little support for this cancer. We're actually an online community, and it's a means of feeling less alone with this cancer. We've got a private group where we can sort of discuss treatment or how we feel, and if we're not having a good day. But really, it's something that there's not a lot of support out there. I don't know whether it's because it can be seen as something that can be dealt with. I don't know, but it's becoming, there is help out there, and support, but we need to look for it.